be on the bench at 11:50.
One of the main advantages of a rural placement, you get to do a lot because there are not a lot of students on placement, and you have your supervisor to yourself and you get to learn more.
I feel in rural you have a really broad experience. So at the moment I'm doing generalist work, so that's sort of across the board. So this morning I saw a 6-month-old baby, and this afternoon I'm going and doing a home visit with a 92-year-old man.
My time here in Toowoomba was amazing, and I think that's definitely put down to the support from SQRH. Right from the day I applied, it was just constant reassurance and support. There was always someone to talk to and call at any time of the day. And throughout the whole 6 weeks I was here, there was always someone responding to emails, just checking up on me, and I felt supported the whole way through.
In my second year of studies, I did a placement out at St George. It was great. I definitely would have to say that it's my favourite placement so far. All the nurses and the staff, even the doctors, everyone was so welcoming. You'd walk down the hallway and everyone would say hello, and it was just beautiful. Clinically, I gained so much experience out there, just having people say, come on Emma, come on, come in, jump in and do this. Like, they would never let an opportunity pass without you being involved.
This rural hospital is quite small, so the team really do work all together. So I'm constantly liaising with physios and speech pathologists, dietitians. It's very interprofessional based, and it's a constant communication between the whole team.
You get the opportunity to see different areas, and there's a lot more interaction with that multidisciplinary team, which you might not really see in the busier hospital environments. So I think that's been a huge benefit.
Being in a rural setting, I learnt a lot more than being in an inner city hospital, mainly because the scope of the midwives here was a lot bigger, and you just got to see a lot more of a variety of cases. Where I am now, we deal with a lot more cases here ourselves, so it's definitely expanded my knowledge of midwifery.
So I was very lucky that I got to watch a cesarean. Like, we actually got to scrub up and go in and be all sterile and everything, which was exciting because I'd never been exposed to anything like that before. You know, anything that came into ED that was interesting, the nurses were going, come and have a look at this, you know, we've got someone with a fish hook through their finger. Like, you know, you never knew what was gonna come through the door, so that was great. And there was a lot of retrievals and flyouts.
So I had a meeting with the nurse unit manager, and we discussed a lot of the rotations that I'll be able to do. So that does include the general ward, the emergency department. We may have the opportunity to work with Aboriginal and Torres Strait Islander people as well, which is really exciting. And I even had a discussion with one of the Rural Flying Doctor Service nurses there, and she'd said that, you know, you need a fair bit of experience both rurally and in critical care settings. So it's an amazing experience to be able to do that out here. The accommodation has been really, really lovely. We've each got our own rooms.
The house is really new, really clean, and it's been a really good experience. At night, when we all have dinner, have a cup of tea, we're able to debrief and talk about the different clients and patients that each of us have seen throughout the day, which has been amazing to hear what other disciplines are experiencing as well, so it's not just OT.
I'm given bikes as well to go ride around the town too, which has been really lovely.
The clientele at the health and wellness clinic obviously meet some strict criteria. They may be from middle age to elderly, whereas the private practice one where I'm at, we get a lot more children, national disability patients. So it's a really diverse caseload, and which benefits me as a student because you get exposure to everyone.
I've had 2 stints at Hall. One was telehealth and the other was face-to-face. The benefit was really working with other students in other professions.
6 different professions here, and they all come together to help the participants with achieving their health and wellness goals.
You really get a good overlap between the professions, whether you're reading heart information about medications, to actually be able to work with nurses and learn a little bit more about medications and different side effects.
There was an excellent level of independence here. There is ample support where you need it, but you do get the opportunity to spread your wings and try things out.
I would encourage other students to do a rural placement because you have the ability and you have the experience to increase your skills as a professional, and also to be able to have that communication with other multidisciplinary team members.
For me, it was definitely stepping out of my comfort zone a little bit, but I think it's a It's a really good experience and like a positive challenge.
It would be the best thing to go rural. I remember thinking that I was going to miss out on things back in Brisbane. I learnt so much in that short 6 weeks, and I think you grow so much in your practice.
There are little things that you will be able to experience here that you wouldn't be able to in a city, and it's not even just clinically as well, it's the whole picture.
The nurses that I've met out west, they've shaped who I want to be as a nurse, and I'll never forget any of them because they've all impacted me and my development as a nurse so much. They're all such strong women and men that they're determined and they know what they need to do and they all get in and do it.